My name's Aegon. I'm one of the anaesthetists. I just wanted to let you know about a VTE prophylaxis tool which has been introduced over the last number of months in the Mater. It started, Dr. Nyana introduced a guideline there about a year and a half ago, and subsequently we audited it the year before last, and we're about to re-audit it now that we've introduced the tool. We just wanted to show it to you and let you know what it's about and where it is. Okay. So it's based on this guideline. There's a series of these in different categories of patients looking at thromboembolic risk in surgical patients. So there's one for orthopedic patients, there's one for non-orthopedic patients, there's pregnant patients, there's various ones. But they stratify patients according to the Caprini score, which is here, and it's complicated, and there's a whole load of risk factors. So we simplified all of this down, okay? And we came up with a tool that we're going to be using here. So this is what it looks like. You circle a number of numbers and you add up a total at the bottom on the left. That'll give you a rough estimate of how likely the patient is to have a venous thromboembolism, and you look on the right to see how they should be appropriately managed. Here are some bleeding risk factors. So if they have risk factors for bleeding, then you need to think more deeply, and the decision needs to be made at a more senior level. So discuss with the consultant, or even if the consultant is making a decision, then at least you can say, well, they've got this, and this, which make them more likely to have a clot, but they also have these risk factors for bleeding. So what we did was we audited it. We had a 3-page audit form the year before last. The first bit on the left is filled out by the anaesthetist in theatre, looking at things like surgical time, duration of anaesthesia, that sort of thing. Were they wearing TEDs when they're in the operating theatre? Sorry. We got a few short questions in recovery to see how their thromboprophylaxis be documented in the surgical note and was it charted. And then we went back through the charts afterwards and looked at all the risk factors just to see how we were doing. In general, this is how they should be managed. The low-risk patients don't necessarily need to be on low molecular weight heparin. If they're moderate risk, they can either have heparin or they can have the mechanical thromboprophylaxis. They specify that it should be the compression devices rather than the TEDs. In high-risk patients, you should consider both. If they've got a bleeding risk, obviously you have to balance the risks and benefits of it. Okay. This is how we got on. Roughly speaking, we had 176 patients. About 25 of those we couldn't get full data on, and 50 of them had a bleeding risk. So we ended up with a subset of 100, and only 41 of them were managed according to the guidelines. Okay. So now we brought this in. It's been in for a couple of months. We've now included it in all the surgical packs. So you probably recognise these things from surgical day ward, but it's in all of them. And we're trying to get people to fill them out at the moment. So you can see them here. But there's been good kind of compliance over the last few weeks, but we want to make sure that everyone's aware of it so that you know where it is and how to fill it out. If there are any, it's also on MaterNet. So on MaterNet, if you click medical across the top and then surgical is the bottom tab, you can see the PDF is there at the bottom. Okay. So now what we've done is it's all gone through drugs and therapeutics. It's now Mater policy. We've got a dedicated thromboembolism nurse, it's Patricia Hall. Her details are on the next slide. The assessment tool is here. It's included in all the packs and it's being filled out. And just letting you know about it in grand rounds. We're going to re-audit it over the next few weeks. And we're going to present it to the new interns before we change it over. We just kind of want people to be familiar with it. We'll let them know as they kind of come on stream as well. And it's going to be audited on an ongoing basis. Okay. And here's the details. That's Patricia Hall. She's the VTE nurse. I believe it's 3708. Dr. Dion is here in the audience. She's the coagulation specialist within haematology. And you can refer to her in the patient centre. And any questions about the audit, you can just ask me in theatre around the place. Okay.
Okay, great. So just kind of letting us know there's an audit. Nuala, have you any thoughts or comments?
No, first, just congratulations to Egan for his Trojan work in getting this big project through, and thanks to all of you for your support today, particularly the interns who've been filling these in. I believe anecdotally compliance is important and it will save lives.
Okay, great. So you'll come back and tell us how the re-audit goes for,
yeah.
the
We'll do.
The quality.